Hi everyone, my name is Woosuk and I am a PhD student at the University of Michigan. Today, I'm going to present our study about challenges in the parent-child communication of health-related information in pediatric cancer care. In the United States, about 11,000 children are diagnosed with cancer each year. While the survival rate has been increasing, nearly 60% of childhood cancer survivors experience severe complications in adulthood, including heart damage, second cancers, and cognitive impairment. This indicates that it is becoming increasingly apparent that childhood cancer is for life. Thus, the parent-child communication in pediatric care is critical for monitoring symptoms and developing self-management skills in daily life. And to promote constructive parent-child communication, researchers have developed tools to help child patients with chronic illness and their caregivers better facilitate health information. For instance, there are a glucose tracking tool, a drawing application, and a token-based communication system. While those existing tools are useful to both children and their caregivers, they do not always address the communication issues with child patients. Also, further research is necessary to understand how technology can intervene to support parent-child health communication in the broader context beyond either health data tracking or the clinical setting. To fill this gap, our study aims to answer the following two questions. First, what are parents' challenges and strategies in communication with children about health-related information in daily illness management? Second, how can technology help parents and children enhance their communication about health-related information in pediatric care contexts? To answer these questions, we conducted an interview study at a hematology and oncology outpatient clinic at a children's hospital. Overall, we recruited and interviewed 52 participants, including 24 pairs of child patients and their parents, 2 physicians, and 2 nurses. The inclusion criteria for child patients are those who are between age 6 to 12 and at least 2 months after the diagnosis. We conducted interviews with them 2 months after their diagnosis because we learned that first 2 months are the most stressful time for both of them. We did not want to add more burdens on them. And interview questions focus on their current communication practices, such as health-related information sharing, their daily routines, and challenges and strategies. Next, I will present our findings about 3 communication challenges. The first challenge occurs when parents and children have different perceptions about being a cancer patient. Right after the diagnosis, most of the parents in our study treated their children as a patient who needed careful monitoring, attention, and care. On the other hand, most children did not fully understand why parents were anxious and how to manage their illness. Particularly after major treatment was done, children believed they became healthy again like their peers. Such different perceptions caused conflicts or reluctances of children to follow their parents' health advice. For example, a mother in our study told her daughter who had abdominal surgeries that she cannot do sit-ups in the same way her friends do. But the child did not fully understand why she couldn't do that and did not want to be embarrassed in front of her friends. So she expressed her anger by denying to go to the school. Next, communication challenge can also occur in choosing appropriate method to explain illness and treatment. Parents in our study primarily used 2 methods to communicate about health-related information. First, using simplified language so that children can easily understand and feel less anxious about unknown medical concepts. Second, communicating the information in its complicated medical form to deliver accurate description about illness and treatment. We noticed that most of the parents in our study used these methods interchangeably based on the situation and the complexity of the information delivered. However, we found that such inconsistency in the parents' communication method may lead some children to feel that method is improper or inappropriate. As one of a consequence, parents' use of a simple language may make children think the information is somewhat misleading or manipulative because it is different from what they are actually experiencing. For instance, a mother in our study and doctors described the blood pressure to a 7-year-old girl as a hug on the arm. However, the child realized that description is different from what she is actually experiencing, so she believed her parents and doctors tried to trick her by treating her like a little kid. The third challenge occurred due to the discrepancies in the children's uncommunicated emotions. In the pediatric cancer context, it was critical to understand the feelings of their children so that parents could provide better emotional support. In particular, chemotherapy, a common treatment for cancer, itself can affect hormones which can lead to the emotional changes. However, children sometimes did not fully understand why and how they should communicate their emotions with their parents. Some children intentionally hid their emotions so that parents would treat them in the same way they did to their healthy siblings. Such uncommunicated emotions may cause confusion and misunderstanding of child's feelings, making it harder for parents to provide timely emotional support to their children. For example, a mother in our study noticed that her daughter was crying and saying she was sorry when it was 5 months after diagnosis. When the mother asked why, the child said she was sorry because she swallowed a piece of gum that caused her cancer. And the mother realized that she could not provide proper support to her child when the child was experiencing huge emotional distress for months. Next, I will present our discussion points and design implications. In our findings, the 3 challenges are caused by parents' lack of awareness about child's implicit needs. Such implicit needs are usually only recognized over time or unexpectedly discovered when communication problems occurred. Our analysis indicates that parents may have a better strategies for the challenges if they have identified their child's implicit needs for health communication. Thus, to support parents, we suggest a communication technology that utilizes scenarios and simulations. Scenarios and simulations have already been used for improving communication skills of healthcare professionals at specific occasions, such as pediatric intensive care unit. Similarly, parents and child patients can utilize a technology that provides drawing-based scenarios or virtual environment. The technology can allow parent-child pairs to dive into specific context or experience related to illness management in daily life. For instance, through a scenario about playing with peers, parents can talk about some restrictions for children's activities and identify their reactions to the restrictions. In this way, parents can discover the implicit needs of their children, since these needs only become apparent in certain situations. And it may be hard for parents to notice these situations in real life. Our findings also show that the temporal difference in the development of needs. Both parents and children's needs do not stay constant. Rather, they shift over time as the parent and child gain more knowledge and face situational changes at different treatment stages. For example, as a child gets more knowledge about illness and treatment, the child may prefer accurate medical terminology rather than simplified words. Thus, it is important for parents to acknowledge and identify such changes in their child's needs. To address such temporal differences in the development of needs, we suggest a timeline-based collaborative system that allows parents and children to align their communication needs. Using the system, parents and children can make communication logs about what can be or should be communicated, when and how communication takes place, and what preferences they have. To sum up, here are the takeaways from our study. We identified those 3 challenges that parents face when they communicate with child patients about health-related information. And I would like to recommend reading our paper for more details about each challenge and parents' strategies to overcome the challenges.